Thank you. Let me first start off by saying that indeed the vaccine helps to prevent transmission. So let me break it down. Our immune system has to respond rapidly and aggressively to ensure that the virus does not take hold and increase to a certain replicated viral load that can cause symptoms and make a person infectious to somebody else. When we use a vaccine to help boost the innate immunological response, then we help strengthen our body's ability to prevent from getting sick. It doesn't work for everybody. Different people have different immunological systems, different strengths. Some of the viral load that somebody gets exposed to overwhelms the immunological response. And so some people still get infected. But what it does do, it significantly reduces the chance that a person gets infected. And that person, when they don't have the symptoms, when they don't get infected in that long term and they are not symptomatic, then the vaccine helped prevent them from getting COVID-19. It's just medicine. It's just the way it works. And so the overall goal in public health with a vaccine is to vaccinate and help boost as many people's immunological system to prevent the viral load from increasing to a certain symptomatic level so that people don't have to get sick to reduce and then to transmit the virus. So yes, it does reduce transmission overall in the general public. And the other thing it has done, and you know, we know this, there's studies that show this in science, and there's also real life examples. How the hell did we get here? How were we able to reduce the transmission in order for us to safely return to schools, to work, to end the public health emergency? Because of the vaccine. Okay, I mean, so for the people that are listening and to the general public, again, for those without contraindication, the COVID-19 vaccine is safe. It reduces your chances of getting infected, i.e. prevents you from getting infected, helps prevent you from getting infected, helps and keeps you from transmitting it to somebody else, and overall transmission goes down. Definitely reduces the risk of getting really sick, reduces the risk of long COVID and death. And the COVID-19 vaccine ushered our nation out of the darkest days of the pandemic. Thanks to the policies that President Biden put in place, including common sense, temporary vaccination requirements to address a dangerous, rapidly spreading, deadly virus, more than 230 million Americans got vaccinated. 3.2 million deaths were prevented, and 18.5 million hospitalizations were averted. Dr. Lynch, what role did encouraging vaccination and increasing uptake of the COVID-19 vaccines, including through requirements, serve in reducing fatalities and hospitalizations?
We definitely saw increases in vaccine uptake when requirements were put into place. And studies have indicated that many individuals noted those requirements as a key factor in their decision to get vaccinated. Vaccines did and continue to offer the most powerful, the strongest protection we have against hospitalization, death, and likely long COVID. So broader vaccination coverage absolutely helped to reduce hospitalization, reduce the risk of overrunning our healthcare system across the United States, and saved innumerable lives.
To help America overcome the pandemic and reduce the harm of COVID-19, the Biden administration implemented requirements for certain populations to obtain the safe and effective COVID-19 vaccine. These high-risk to catch and spread virus populations, including those who are serving federally funded healthcare facilities as part of our federal workforce and as members of our military. And as a result of these policies, these communities achieved remarkably protective high vaccination rates, including 98% vaccination among federal workers, 96% among service members, and nearly 90% among healthcare personnel. Dr. Lynch, why were requirements a clinically appropriate tool to boost vaccination rates, and how have they been used in context outside of the COVID-19 pandemic to reduce the threat of other dangerous diseases in the United States?
Requirements, in combination with efforts to make the vaccine freely and equitably available, and robust communications about vaccine safety and efficacy, were all and continue to be appropriate tools. When vaccines became available, most of the population had no immunity, a critical, important factor. So we needed to increase vaccine uptake as quickly as possible to protect as many citizens as possible. For years, we have seen influenza vaccine requirements for healthcare personnel, school entry vaccine requirements for children, function to save and support our communities. These have all been highly effective tools in protecting all of us from severe infectious diseases.
Thank you. You know, we heard a lot, and including have read in the announcement of this hearing that the implementing vaccine requirements, the Biden administration, quote unquote, disregarded patient-physician relationships and took doctors completely out of the conversation. So I want to really discuss this. America's leading medical societies, including the American Medical Association, the American College of Physicians, the American Academy of Family Physicians, the American Academy of Pediatrics, and many other doctor groups, all express strong support for vaccine requirements as a critical tool, temporary critical tool under these circumstances to help America overcome the pandemic. And in numerous court cases, including the legal challenge to the vaccine requirement for large employers, the AMA and other major medical societies filed amicus briefs supporting these policies. Dr. Lynch, you are the only physician testifying on today's panel. So let me ask you, physician to physician, do you agree with the allegation that doctors were sidelined and that patient-physician relationships were disregarded in the discussion surrounding vaccine requirements?
So I'm a leader and an active member of the Infectious Disease Society of America. I know many infectious diseases doctors across the United States. I'm an active faculty member at the University of Washington, a leading research institution for infectious diseases, where I know many of my colleagues work in the same area. This is not the case in my experience, nor the experience of many of my ID colleagues. We do not feel sidelined in those conversations. I've been active participants in all of those conversations. At my institution, we were the ones that my administration approached for guidance on vaccine policies. At an individual level, physicians have been actively involved in talking to their patients about vaccines, where those physicians' appointments were accessible to those individuals in the community. However, we do have a serious physician shortage, particularly in the ID specialty, and many people don't have sufficient access to physicians, again, contributing to inequities around access. I agree we can and must do better to ensure everyone can access a physician.
I appreciate that, and we'll work to make sure that we increase incentives and work on the doctor workforce. But I just have one last point to make, so I need to move on. So there seems to be a message that infection-acquired immunity precludes the need for many Americans to receive the COVID-19 vaccine. In May, the Select Subcommittee held a hearing on this topic, and we heard from Dr. Tina Tan, who emphasized that hybrid immunity conferred by both infection and vaccination offered greater protection than infection-acquired immunity alone. And isn't the point to get the vaccine to avoid getting sick and the symptoms or the risk of long COVID? So, Dr. Lynch, could you once again explain for us why this is the case? That even people who have had infection should still get the vaccine if there's no contraindications?
Yes, I agree with you. All data have indicated that individuals with prior infection who have survived and vaccination appear to have the strongest protection. So getting vaccinated after having been infected provides that hybrid immunity, which appears to be the most potent way.
Would you suggest to boost your immune system by getting infected rather than getting the vaccine?
Absolutely not.
Would you suggest to avoid getting the infection by getting the vaccine?
I would.
Thank you. So I think what we say matters, and how we say it, and whether it's subtle or not so subtle. I do think that we should just look at the big picture and understand that some individuals shouldn't get the vaccine due to contraindication in their own health status, and that consultation is with patient and their doctor. But the vast majority who have no contraindications can significantly reduce the risks of getting long COVID, of getting symptomatic, of getting really sick, and dying by getting the vaccine. And by getting the vaccine, you boost your immune system, you reduce the risk of getting the illness and transmitting it to somebody else. It worked. That's why we're all here in our committee, and the public health emergency is over. Declaration is over. Thank you. I yield back.